Now, what if you retire before age 65? Well, you're probably going to have to spend on out-of-pocket ACA public marketplace insurance, which is, if you haven't looked at it before, is shockingly expensive. I mean, for some people, you can go on COBRA, stay on your existing plan for a short period of time, but that is typically a cost-prohibitive option. And some of the other options out there are just very unique. So most people are going to have to go with ACA plans. As you can see, those get really expensive as you get into your 50s and 60s. In fact, if you look at this table here from smartfinancial.com, you can get an idea of exactly what you should plan to pay, at least on average. And you can see, like, if you're all the way up to your 60s, it's gonna be $12,000, $13,000, $14,000 per year. And this is just for kind of on average silver plan. Now, if you really want to dial in your number, you can go to your state's marketplace exchange and get an actual quote, which will dial in your marketplace costs for your individual situation. So that's what I'd recommend, even if you don't need it yet. Now, for your out-of-pocket spending, if you are under 65, I would include these marketplace insurance premiums, and they're big, unfortunately. I typically don't add a separate line item for out-of-pocket cost for those under 65. That's typically captured in my clients' overall spending numbers, which is typically just one big number. However, if you are going to break that out, you can kind of go two ways. One, just review your actual out-of-pocket healthcare spending over the last few years to get a rough idea. Or two, you can take Fidelity's $3,584 out-of-pocket estimate for a 65-year-old and adjust it for your unique health, your unique circumstance, your unique insurance. You know, obviously, if you're going to retire in your 50s or early 60s, on average, you're going to spend less out-of-pocket on healthcare than somebody 65 plus. Although if you've got a pre-existing condition that's very expensive, take that into account. Hopefully, this has given you a lot of great data as a starting point as you plan for your healthcare costs in retirement.